Hello everyone, I am Dr. Deepak Changappa, consultant pulmonologist. After the outbreak of monkeypox worldwide and presence of 2 cases in India, there has been a lot of doubt regarding monkeypox and many of my patients approached me to clear their doubts. So I thought I'll make a video regarding monkeypox and put it over the internet. So monkeypox is a viral zoonosis, that means a virus which is transmitted to humans from animals with symptoms similar to those seen in the past in the smallpox patients, although it is clinically less severe than the smallpox disease. Monkeypox primarily occurs in Central and West Africa, often in proximity to tropical rainforests, and has been increasingly appearing in the urban areas also. Animal hosts include a range of rodents and non-human primates. Monkeypox virus is an enveloped double-stranded DNA virus. Now, the natural host of monkeypox virus are the squirrels, rats, dormites, primates, and other species. The uncertainty remains on the natural history of monkeypox virus, and further studies are needed to identify the exact reservoirs and how virus circulation is maintained in nature. In May 2022, multiple cases of monkeypox were identified in several non-endemic countries. That was a cause of concern for every one of us. And studies are currently underway to further understand the epidemiology, source of infection, and transmission patterns. And how does it transmit? Transmission from animal to human can occur from direct contact with the blood, body fluids, or cutaneous or mucosal lesions of the infected animals. Eating inadequately cooked meat and other animal products of infected animals is a possible risk factor. People living in or near forested areas may have indirect or low level exposure to infected animals. Human to human transmission can result from close contact with the respiratory secretions, skin lesion of an infected person, or recently contaminated objects. Transmission via the respiratory droplets particularly usually requires prolonged face-to-face contact, which puts the healthcare workers and household members and other close contacts or active cases at a greater risk. Transmission can occur via the placenta from mother to fetus, which can lead to congenital monkeypox, or during close contact during and after childbirth. While close physical contact is a well-known risk factor for transmission, it is unclear whether this monkeypox can be transmitted specifically through the sexually transmitted routes. Studies are needed to better understand this risk. So let us know what are the signs and symptoms of monkeypox. The incubation period, that is the interval between the infection to the onset of symptoms of monkeypox, is usually 6 to 13 days but can range from 5 to 21 days. The infection can be divided into 2 periods, that is the invasive period, which lasts between 0 to 5 days, which is characterized by fever, intense headache, lymphadenopathy, that is a swelling of lymph nodes, back pain, myalgia, and intense asthenia, that is lack of energy. Lymphadenopathy is a distinctive feature of monkeypox compared to the other diseases that may appear initially similar to monkeypox, that is chickenpox, measles, and smallpox. The skin eruptions usually begins within 1 to 3 days of appearance of fever. The rash tends to be more concentrated on the face and extremities rather than on the trunk. It affects the face, that is in 95% of the cases, and in 75% of the cases it affects the palms of the hands and soles of the feet. And also in 70% of the cases it can affect the oral mucous membrane, and genitalia affection is seen in 30% of the cases, and in 20% of the cases it can affect the conjunctiva also. Sometimes it can affect the cornea. The rash sequentially evolves from macules, that is flat lesion, to papules, slightly elevated lesions, to the vesicles, which are filled with the fluid, and then this fluid gets infected and form the pustules. That means the fluid becomes yellowish in these vesicles, and crusts, which usually dry out and fall later on. The number of lesions varies from a few to several thousands in patients depending on their immunity. In severe cases, lesions can coalesce until large section of a skin falls off. Monkeypox is usually a self-limited disease with the symptom lasting for about 2 to 4 weeks. Severe cases occur more commonly among children and are related to extent of viral exposure, patient's health status, and also the nature of complications. The underlying immune deficiency may lead to a worse outcome, for example HIV infection, diabetes, and also malignancy. Although vaccination against smallpox was protective in the past, today persons younger than 50 years may be more susceptible to monkeypox due to cessation of smallpox vaccination campaigns globally. Complications of monkeypox can include secondary infection, bronchopneumonia, sepsis, infection of the brain called as encephalitis, and infection of the cornea, which can lead to complete loss of vision. The extent to which asymptomatic infection can occur is not known in this epidemic. The case fatality ratio of monkeypox has been historically around 0 to 11%, but in the recent epidemic it has found to be around 3 to 6%. How to diagnose this disease? Once monkeypox is suspected, polymerase chain reaction is the preferred laboratory test, given its accuracy and sensitivity. The diagnostic samples for monkeypox are taken from the skin lesions, that is the fluid from the vesicles and pustules, and sometimes the dry crust. Wherever possible, biopsy is an option. The lesions sample should be subjected to PCR tests. It should be stored in a dry sterile tube and should be kept cold. And PCR blood tests are usually inconclusive because of the short duration of viremia related to the timing of specimen collection after symptoms begin, and should not be routinely collected from patients. And once diagnosed, how to treat these patients? The clinical care for monkeypox should be fully optimized to alleviate the symptoms, manage complications, and to prevent long-term sequelae. Patients should be offered fluids and food to maintain adequate nutritional status. Secondary bacterial infections should be treated as and when indicated. An antiviral agent known as tecovirimat has been approved by the European Medical Agency for monkeypox in 2022, which is based on the data in animal and human studies, which is not available widely worldwide. The vaccination against smallpox was demonstrated through several observation studies to be effective in around 85% of the cases in preventing monkeypox. The smallpox vaccination may cause milder diseases. A newer vaccination which was developed in 2019 for smallpox has been approved for use to prevent monkeypox virus infection. So, how to prevent spread of this human to human transmission? Raising of awareness of risk factors and educating people about the measure they can take to reduce exposure to the virus is the main prevention strategy for monkeypox. So, until and unless we have a full-fledged vaccination, I request everyone to be aware of this disease, and if you come across a case of monkeypox, please avoid contact with them. Thank you very much. If you have any doubts regarding monkeypox, please mention it in the comment box. I will try to answer it. Thank you very much.